So welcome so much again to AfyaNCD series, and today we'll be talking about cardiovascular risk profile. So I'll translate cardiovascular risk profile into Swahili word to mean Maradhi ama magonjwa ya moyo. Now in this context or in this session we'll be talking about modifiable and unmodifiable risks that are associated with the cardiovascular diseases. Modifiable is something that you can change or you can modify, from the word modifiable, and for non-modifiable it means something that you cannot change and is actually a risk. When I say a risk, it means something that can exacerbate or can elevate or can lead to much prevalence of the cardiovascular disease associated with that risk. So I'll start with modifiable. Modifiable is something that you can change based on lifestyle or how you live, because I said all these cardio cancers, diabetes, and chronic respiratory diseases can be determined by how you live or what you eat, or basically the lifestyle. So I'll talk about, and I'll start with the modifiable. So modifiable, number one, we have obesity. Obesity is a risk to cardiovascular because of the BMI. BMI means body mass index. So body mass index means the ratio or the proportion of your body weight to your height square. So people who have high BMI, that's people who are heavy and they are short. You are weighty or you have a lot of weight compared to your height. That means that you are obesity and you risk having cardiovascular disease. Number two, we have smoking. We know that the cigarettes that we do smoke have been proven to have more than 4,000 chemicals. Things like nicotine is responsible for addiction and is also harmful to your heart. And we have tar. Tar is the chemical that causes the blackening of the lungs. And we have a silent killer gas, which is carbon monoxide. Now the rate at which your cells, the red blood cells, can carry oxygen is very much less as compared to how your cells can carry carbon monoxide. That therefore means that your body has a very high affinity to carbon monoxide more than your oxygen. And based on the fact that this carbon monoxide is very much poisonous, therefore means that if you are constantly exposed to carbon monoxide, it actually leads to poisoning of your blood, and that actually affects your heart. Now we also talk about alcohol as number three. Alcohol causes vasoconstriction. The binge consumption of alcohol causes vasoconstriction. Vasoconstriction is the thinning of the lumen of your blood vessels. Your lumen becomes small, or the size of your lumen becomes small, and actually causes blood pressure because your blood has to be pumped with a lot of force compared to how it was when you are not consuming a lot of alcohol. And it also causes extra calories. These are empty calories. Empty calories means that you are having calories, oh yes, but are not nutritive. They don't have any nutritive value, so that means they're empty. And it also causes cardiomyopathy. Cardiomyopathy, you can say the swelling of your heart muscles and the effects of their heart muscles, and that's actually poisoning. Number four, we talk about the diet. How or what do you consume? What you consume or what you eat, drink, also has a side effect or has an effect to your cardio. For example, if you consume a lot of salt, for example, a lot of sugars, a lot of fat, foods that are containing a lot of fat, you risk having a cardiovascular issue. Now we also talk about physical inactivity. You are just eating and sitting there. It is very, very much dangerous for you, and that's why it has been proven that people who actually exercise their body, running, going to the gym, doing cardio exercises and so on, they are very much less to be attacked by any cardiovascular disease of any kind because of the physical activeness of the body. Now we also have the last risk factor that's modifiable as hyperlipidemia. Hyperlipidemia means that accumulation of cholesterol into your body. Now We understand there are four forms of, I'll say three forms of cholesterol that are being transported in your body, and the first one is high density lipoprotein, low density lipoprotein, and very low density lipoprotein. Of all those three, we can say that low and very low density lipoprotein are very harmful because they are deposited to the arteries of your circulatory system, and when they are deposited on the hearts of your circulatory system, including the heart, then means that in general the work of the heart is compromised, and that can elevate the blood pressure, and that can risk you to other cardiovascular diseases that are related to the heart. And so after talking about obesity, smoking, alcohol, diet, physical inactivity, and hyperlipidemia, let's now look at the non-modifiable. Non-modifiable, just like I've said, you cannot change, or you have very minimal chances of changing that risk profile. And for non-modifiable, we have age. If you get old, you are high or at risk of getting cardiovascular diseases. And age is correlated to gender. For example, men when they reach at the age of 55, and for women when they reach at the age of 60, they are prone, or they are highly or susceptible to getting these cardiovascular diseases. Number three, we have family history. If any of your close relative, that is your parent, your brother, your sister, your father, your mother, or even your grandparents, any of them had any of the cardiovascular diseases, that means you're also at risk because of this a bit of inheritance and variation, that is genetics. And we also have the last bit as race and ethnicity. Now, race and ethnicity encompasses how you live, where you live, what you eat, your culture, and so on. For example, we know that Arabs they like eating spiced food, and spiced food, some of them, they have a negative impact to the heart. And for example, you can say people who are maybe Europeans, people who can afford the kind of the lifestyle, may prefer processed food, and the processed food, they are very much risky. That forms the dirty part of it, and and that can be harmful to your heart. So you cannot deny your race, you cannot deny your ethnicity, and you cannot deny maybe your culture, and that forces you to live how you are supposed to live, or how your culture defines you to live. And that makes this whole issue about cardio less modifiable. Now, in the nutshell, or in the baseline, that this cardio can be controlled, and the